Hi, my name is Karen Bowman. I'm the Environmental Health Specialist for the Washington State Nursing Association, and thank you for taking time to listen to this video. So how did I get involved in environmental health advocacy? Well, my background is in occupational environmental health. I'm a graduate of the University of Washington. The American Nursing Association a number of years ago was given a sum of money by a private foundation to build bridges between nurses and environmental advocacy organizations, because nurses really are the spokespeople on environmental health. And so the Washington State Nursing Association got a sum of money, and they developed a job position called the Environmental Health Specialist, and that's how I got the job, and I've been doing that ever since 2005. We started out by educating the State Nursing Association and the constituents and the management, so everybody knew what the current environmental health issues were and what they could do to reduce toxics in the environment. The second thing we did was go around the state and educate the nurses around Washington State, on the east side, on the Pacific Coast side, up by Bellingham and all the way down to Vancouver, Washington. So everybody was on the same page about what nurses could do.
So why do you think it's important for health professionals to get involved?
It's critical that healthcare professionals get involved, especially nurses, because Florence Nightingale, if you think about the science and think about Florence Nightingale, I think she was actually the first environmental health nurse. She always touted about putting the patient in the best environment for them to heal themselves. Clean water, pure food, good sanitation, light, and good air. And so if you can't put a patient in a clean environment, if you can't put them in a health protective environment, then we've got a big problem on our hands. It's all about prevention. Healthcare providers, it's all about prevention. It's all about going upstream to try to figure out how individuals became sick to start with. We want to prevent those diseases.
Okay, and what are ways that healthcare providers can get involved to make a difference?
This is easy. So how can healthcare providers get involved? It all depends on how much time you want to put in. You can take minutes to hours, and as I always say, it's, you take minutes to hours, and then it's all about nurse world domination, right? So you can get on ledge.wa.gov or your local state government website, find out who your legislators are, and send them an email really quick. It's very easy to do. They make it real simple, and you can just type in your concerns and your comments about chemical policy reform. You could say something like, I don't want my children to be exposed to these toxic chemicals. I don't know what toxic chemicals are in my children's products. Being a nurse, being a parent, being a grandparent, we all have a role to play in doing that. So you can start by just getting on the website and talking to your legislator, sending them an email, or you could call them. The next step would be going down and actually meeting them in the Capitol, or you could go to their local office and just sharing your feelings about chemical policy, sharing your story, talking about your children, your grandchildren, the people that you take care of. If you work in a cancer ward or a hospice unit or a NICU, you have a story that you can share, and those legislators listen to that. So we've talked about sending emails, we've talked about calling your legislator, we've talked about going down and talking. The next thing is building bridges and starting to collaborate with environmental advocacy organizations like Washington Toxics Coalition or Toxic Free Legacy Coalition or Washington Physicians for Social Responsibility or Planned Parenthood. Any organization that can advocate with you for environmental health. They have the science, you have the expertise, you blend your voice with their voice, and it's a powerful, powerful voice. Healthcare workers are so well respected by the legislature and by your legislators in particular, because you're their constituents. So, just as a reminder that that nurses are the largest healthcare provider in the United States. We provide over 80% of the healthcare worldwide. We're the most trusted profession, and people listen to us. We're everywhere. We're in schools, we're in department stores, we're in industry. We are just everywhere. So what else can you do? So if you can bridge with the advocacy organizations and then start going to the Environmental Health Lobby Days or the Washington State Nurses Association Lobby Day, and you can learn more about the issues, the current issues, and find a passion. So you find a passion, you can hook up with a mentor, and you can learn how to do the process. Then, when you have the process down, I want you to go and teach it to somebody else, because that's how we spread the word, and that's how healthcare providers start reincorporating policy development back into practice. It's critical. We have a professional obligation to ensure that environmental health policy, all health policy, has a physician's voice, a nurse's voice, a medical assistant's voice, an LPN's voice. We are the experts. If we don't talk about health policy and advocate for environmental health policy, then it's left to the legislators and the lobbyists to determine what health policies go in and what doesn't.